Here's a story of interest for our viewers. The state of Texas has stopped most abortions under a new statewide order to conserve medical supplies during the coronavirus pandemic. According to the state's latest data, the new measure could save more than 2,800 lives, which is 66% of abortions in Texas for the month. The Texas Right to Life is calling on state lawmakers to expand the order to include chemical abortions as well. And joining us now is the legislative director of Texas Right to Life, John Seago. He has more on this topic. John, the halt in abortions is supposed to last through mid-April, but do you think it could go on longer?
Well, thanks for having me, Mark. We're not sure. The executive order was signed yesterday by our governor. And what we see is that we haven't actually had the response from the abortion industry yet. But during this pandemic, the abortion clinics in Texas have stayed open, even though state and local leaders have suggested that they close. Now we have this order that says only necessary medical procedures should go forward, and only all the elective procedures should be delayed. And so the order applies to abortions, and we're ready to see these lives saved.
Aside from saving the lives of the unborn during this time, how will stopping abortions help medical facilities across the state dealing with this coronavirus outbreak?
Yeah, in the governor's order, it explains that one thing Texas needs right now is we need to free up hospital capacity, but we also need more personal protective equipment, the masks and gloves and gowns that our first responders and that our healthcare professionals who are treating patients who have COVID-19, they need these equipments. We're actually facing a shortage here, and all of these other elective procedures and these facilities that are staying open are using those very important personal protective equipment. And so what the kind of idea behind the order is, all these elective procedures should stop. Any extra PPEs should be sent to, for example, here in Austin, St. David's, that has several cases that they're treating right now, but they're facing a shortage of those masks and gloves.
John, what has been the pushback? What has it been like from the abortion industry over this decision?
Well, the order was signed yesterday afternoon, and as far as we can tell, the abortion industry has not responded at all, which is very odd. Usually they're right there ready with a lawsuit or with a press release. We haven't seen them respond at all, and so we're watching that very closely. We expect them to fight back. We expect them to try to say that they're exempt under some of the wording of the order, or to try to explain that that abortion is essential healthcare. We've seen them say that in emails because in the last few weeks they've been criticized as being still open in Texas cities. And they've said, no, what we're doing here is essential healthcare. But the wording of the order says only the procedures that are immediately medically necessary. An elective abortion hardly ever is in the case to save the life of the woman, to protect the life of the woman. And so the vast majority of elective abortions should be affected by this order, and we should start seeing enforcement of it as soon as possible. We're working with our governor and attorney general to make sure that this is actually followed, and there are penalties attached to the executive order if someone is still doing these elective procedures. So we're monitoring the situation and going to make sure that the abortion industry is held accountable.
All right, so the order has teeth to it as well. Okay, John Seago with Texas Right to Life. Thank you, John. Thanks for breaking that down for us.
Yeah, absolutely. Thanks for having me.